Hey, welcome back to the Build Beyond podcast. I'm your host, Chris Netley. As always, this podcast exists to challenge and guide you so that you can reach your full potential. This episode is going to be specifically about low back pain. Actually, even more specifically, this is going to be about low back pain that travels out of the back down into a leg. So if you have this problem, or you've ever had this problem, or you know someone who has this problem, or maybe you're just concerned that you might have this problem in the future, I think this episode is going to be valuable for you. This is something that happens quite commonly to a lot of people. Low back pain is, as far as I know, the stats say that they estimate that 80% of the population globally is going to deal with low back pain at some point. I would imagine it's a smaller sliver of the population who deals with low back pain that travels into a leg, but it's still a lot of people. This idea for the podcast actually came from a discussion that I had today. I have a friend who's a healthcare provider. He's working with someone who has a similar issue, and he wanted to bounce the case off of me and explain what he was doing and seeing if I thought that he was missing anything or if I would have handled it differently at all. So here is the general patient case. You have a person who was in the gym and was lifting weights and started to feel low back pain. This person goes to the gym a lot, relatively young and athletic, wasn't doing anything crazy in the gym, was doing a lift that they do quite often. And it had the lift had something to do with hip flexion. So deadlift, bent row, they're bending forward with a barbell under load and started to experience low back pain. The back pain started off centralized, so it was right in the middle of the low back. And then progressively over time, it started to spread and go wider out to the sides, and then eventually ran down the back of one of the legs. And when it went into the leg, I think it was either the back or the side of the leg was also numb. There was numbness and tingling. And the person reported feeling some weakness in the leg as well. So with therapy, or when they had been working with this person, the pain had the symptoms in the leg weren't changing, and they were getting a variety of changes in the low back pain. So some days it would be better, some days it would be worse. There'd be consecutive days where it was feeling good, but then they would push a little bit harder, or just something in life would kind of trigger it and would come back again. But the pain in the leg wasn't changing. So that is the scenario. And well, one more thing to add to the scenario. This has only been going on for 3 weeks. So this is relatively acute, is what we would say. This is not a chronic problem yet. And I didn't ask if this person had a history of low back pain. That may or may not be relevant. I think it's relevant in terms, it's relevant if you think about the fact that once you have low back pain, it's not only is it common, but once you've had the pain, it's probably going to come back. I think it's almost 100% guaranteed that you're going to have low back pain at some point. Again, it's not really something at this point we're very good at abolishing completely from your life. We can manage it, but it's not, there's no like cure for low back pain yet, as far as I know. Okay. So my advice, and this was my advice to my friend, and this would be my advice to you, is let's not worry about the low back pain. Let's worry about the leg to start with. We need to get the pain, numbness, and tingling out of the leg, and we need to make sure that that leg returns to full strength ASAP. Now, the strength loss could be a couple things. Sometimes you just have pain, numbness, and tingling, and because of the pain, you're weaker. It's more of like related to the pain than it is maybe a neurologic problem. But since I didn't do an exam or a history on this person, we have to consider the possibility that the nerve, or at least one of the nerve roots, has been affected, and that's what's creating the weakness. We would call that a radiculopathy. Weakness is usually one of the first things to show up when a nerve root's been affected, but it's also one of the easiest things to get rid of. But that's my main concern, because especially from an athletic standpoint, if you're an athlete, if you do have something going on with the nerve and you are weaker because of it, and we rush you back too quickly then you run the risk of another injury. Let's say like a knee injury or an ankle injury. I believe that it would increase your risk. I don't really have a lot of data to support that, but it's just if you got a nerve problem and the muscles aren't firing and you're weak, it's going to be harder to stabilize the joints. So whether you're an athlete or just an active person or just someone who's trying to manage a busy schedule with your kids, we want the nerves working. We want your reflexes good. We want sensation good, and we want strength to be good. Right. So that's where I would actually focus first. Now, how would we do that? Well, there's a lot of different ways. The way that it was described to me was this was more of like a flexion related problem. I would want to test that to see. So we would want to see, how can we recreate it? Can we make the back pain and the leg symptoms worse? And then can we make them better? So for example, maybe bending forward or bringing one leg up, like a straight leg up, makes things worse. Well, does bending back or moving the leg back, does that make things better? It may not instantly, but it's something you can work on with stretching and mobilization. I can't really go into every scenario on this podcast, but I would say step one, if you've got low back pain and something in a leg, let's work on the leg and let's try and abolish those symptoms as quickly as possible. Let's get full strength back in the limb. Let's get sensation back, and let's get rid of that numbness and tingling to the best of our ability. And if we can, let's rule out a back problem, because with this particular instance, he had back pain first and then it spread out to the leg. Sometimes you could have leg pain and low back pain and they're not necessarily connected. That's why it's hard to make a podcast episode that covers every possible scenario. But it seems like from the information that I had that the leg issues are coming from the back. I would want to test that. I would keep my eye on it. That would be kind of the top of my list. And I would try and do stretches, mobilizations, exercises, whatever I could do over time to help abolish those symptoms on the leg to just have low back pain. Now, here's an important thing. If this works, what will likely happen? The back pain gets worse a lot of time, not all the time, but it's very common for us to get success in the leg, and then but then that pain kind of centralizes to the low back, and you just have more of an aggravated low back. That's a good thing. Not 100% of the time is it a good thing, but it's very common, and it's something that I look for, and I have to prep my patients for that. For the pain, if the leg recovers and the low back pain gets worse, then we're only dealing with low back pain, and it's not spreading to the leg. So that's a positive. So I would be looking for stretches, mobilizations, positions, activities that reduce the symptoms in the leg and possibly increase the low back pain. Hopefully not, but possibly. I would also be constantly testing to make sure that strength is coming back. As quickly as we can, I would want to get that person back to exercise or keep them exercising. So I'd be looking for things that don't aggravate the low back pain. So it might be something simple like maybe bicep curls, seated bicep curls, standing bicep curls, seated knee extensions might be okay, depending on whether or hamstring curls. I don't know. There's a lot of different things you could do. I would want to try and keep that person as active as possible, because we don't want to affect their health and their total overall physical activity just because they have some pain. We can work through that. So I'd be thinking of creative strategies to keep the person active. From a strengthening, conditioning, and rehab standpoint, I would probably, as quickly as we can, start with some isometric exercises. So isometric is like, in this case, it'd be like a plank. Is there any version of the plank that we could have this person do where they're bracing the core? Maybe dead bug. It's isometric in the core, but you're moving your arms. If you don't know what that is, I'm just throwing out stuff. I would be looking for things where the muscles are contracting, but there's no movement. We're just stabilizing. There's two reasons for that. Well, maybe more than two. One good reason is that isometric exercise tends to have a pain reducing effect. Since it's minimizing movement, it minimizes fear. It helps build strength. It's a good way. You can build a lot of strength, and it's a nice, palatable step in the right direction when someone's in pain. And then as they're able to tolerate it, I would start to add back the painful movements. So let's say bending forward is painful. At some point, we got to start adding that back. We can't just avoid bending forward. So I would kind of play around with sprinkling that in as soon as I can, with as long as it's not making the symptoms worse, because we have to very quickly acclimate them to that movement, both physically, neurologically, and psychologically. And from there, I would start adding just more. I would just make things more complex and thinking about what they want to get back to. So I would, if it's a sport or if it's some type of lift, we might start really light. We might start with like a PVC pipe or a broom handle, working through those range of motion. It's a good opportunity to work on some technique. It's a good opportunity to do some isolation exercises. So maybe some more like bodybuilding type stuff. We can work on other skills, but that is in general, in very broad terms, how I would handle something like that. And then I would be looking all along the way, is this person responding to the treatment plan the way that we would hope or the way that we anticipated? Because if they do, then that's good, right? So if they're getting better in the ways that we predict that they should get better, then that's a green light and we know we're on the right path. Another option is that they don't improve, but they don't get worse. So no better, no worse. It's just kind of staying the same. That's more of a yellow light. We're not necessarily on the wrong path. We may just need more volume. We may need a slightly different exercise. We need to tweak something. That's what it tells us. But we're kind of headed in the general direction that we want to go. And we're keeping them active. So it's all good. And then the other option is they get worse. If they get worse, then we know we can cross that off the list. Right? That hypothesis doesn't work. We move on to something else. Now keep in mind, this specific case had only been going on for 3 weeks. So low back pain, especially pain that goes down into the leg, the natural history of that, I mean, for some people, regardless of what you do, it's going to linger for a lot of people for a long time. I couldn't even quote you what the research says, but months sometimes. I mean, that's not abnormal. And sometimes people feel like, oh, I've had this low back pain and this pain in the leg for months. And it's like, yeah, that's kind of the way it goes sometimes. But you'd be looking for the small wins. Is it improving? Are you able to do more stuff? The low back pain's there, but how are the symptoms in the leg? Are they getting better? Is there anything that we can do throughout the day or that you can do to improve your situation? And basically, there's not I don't have a cookie cutter format for it. This is in general for a lot of people, the high level view of what I'm looking at, but there's a lot of variability within the treatment plan. Because it depends on their age, it depends on their activity levels, it depends on their schedule. Are they an in-season athlete, an out-of-season athlete? Is it a mom with 3 kids who's just got to get going and got to get, she's got to keep moving? Every situation is going to be a little bit different. But in general, if you have low back pain and then it spreads to the leg, so low back pain first, spreads to the leg second, my number one priority is get that pain out of the leg, get the numbness and tingling out of the leg, get the strength back into the leg. If the low back pain gets worse, but we can pull it out of the leg, that's usually good. I'm not really going to nitpick because then I'm only dealing with the low back pain. And this isn't going to work all the time. And this podcast episode should definitely not be used as medical advice, because there's a lot of stuff that can cause low back pain and leg pain. That's not orthopedic. That's not neurologic. So if you have low back pain, I'm just trying to give you an idea. If you have this problem, I'm trying to give you an idea of what a good plan could look like. I would still recommend that you go get evaluated. What I'm hoping that this podcast episode provides is more information, because then you can ask better questions, because you might go to a healthcare provider and they recommend something totally different than what I just told you. Well, you could ask why if you wanted to, if you had that kind of relationship with them, or at least you understand that maybe what they told you is not the only option, and maybe you go get a second opinion. I don't know. It depends on a lot of different factors. I think I want this podcast episode just to serve as information, not as advice, because I may not even stick to this plan with every patient either. So go get evaluated. If you have questions, shoot me an email, give me a call. I'll see if I can help. But I hope this podcast episode was helpful. And thank you for listening. And I'll catch you on the next episode.